The first question I have is for Dr. Shah, and the question is, how does heartbreak, and does heartbreak feature as a major cause for depression?
Yes, absolutely. Actually, many people think heartbreak is not a serious issue, but in fact, heartbreak may be the cause for as many as 20,000 suicides a year in our country. And for a lot of young people, heartbreak is the first serious emotional kind of problem they have to deal with. And for those who are genetically vulnerable, that can cause depression, clinical depression. So it's definitely a part of, for many young people, that is a cause of depression.
So this question was from Rahul. And another question that I have for you, Dr. Shah, is from Daksh. And he says that he's been on medication for depression for many years now. And he was wondering whether there would be a long-lasting effect on the physical organs of the body. What would you say?
A number of people take antidepressants long-term to decrease the risk of the condition coming back. So for people who have if the doctor thinks there's a chance of relapse, then medicine is recommended long-term. And many people have taken it for decades, and as far as we know, with all the data, there are no long-term side effects. And over time, though, you have to weigh the risks and benefits. If the risk of the depression or the disorder itself is far in excess of any potential risk of the medicine, then we elect to take the medicine because of the risk of the condition itself. So it's always about balancing risk and benefits. But for most people who are taking this medicine long-term, they're doing so because it actually increases their quality of life and decreases the risk of relapse.
Thank you. Question for you, Deepika, is from a girl called Sharda, and she says that she hates being depressed so much that every time somebody mentions the word depression, she gets very angry and upset because she feels that it's being forced upon her that she's depressed. What kind of advice would you give to Sharda?
Well, I always believe that it's important to accept and embrace. I feel, and not just at the level of mental illness, but I believe that in anything in my life, I feel like it's important to accept and embrace any situation that you go through in your life. I think it sort of just gives you a better understanding of how to deal with certain situations. You're not tensing your body up, you're releasing, you're letting go, and I feel it just makes me more at peace. I feel more at peace versus when I try and fight a particular situation. It also gives me clearer insight. I feel it sort of gives me a clearer understanding of any given situation. So I would say, I personally, believe that I think it's important to accept and embrace, and not fight either your own circumstances or what people might be imposing on you.
So, Anna, many people, including this young man called Rupert, wants to know how does he go out with his depression to friends and more importantly to parents. The question here is, my parents don't understand because parents want me to be this perfect boy, and I know I am depressed, but how do I get that across to my parents?
I don't think you have to restrict yourself just going to your parents. If your parents, for any reason, are not able to understand what you're going through, it's okay for you to choose a friend whom you feel you can trust and share what's happening to you. And the second step would also be to take professional help, which is available now all over. There are even NGOs working in the field of counseling, and you can go there too. And they do maintain confidentiality till he himself wants to, share with his parents that he has.
So, Ujjwala, this question is to you, and it's, I think I ask this question for a whole lot of people who are caregivers for people who are going through mental health issues. By the fact that you have had this experience as well as a caregiver, what would be your advice to other caregivers?
I would say, first of all, utmost patience is what is needed, because it's not like a simple ailment like other where you take a 5-day antibiotic course and 6 days you're back to normal. So it could take depending on the severity, it can take months, it can take years. So the caregivers need to be extremely patient. They need to put up, I mean, irrespective of what they may feel or be going through, you definitely need to put up a brave front and be positive with the patient so that they feel positive too, and keep giving them the confidence that, through medication, through counseling, through family and friend support, you're definitely going to get all right. In very severe cases, I used to be paranoid about wanting to be around the mentally ill person, because you never know what kind of thoughts are going in their head, and you don't want them to harm themselves, and all that negativity that is going on in their mind. So being around physically with them at all times, either by yourself or with another friend or with some family members, I thought was very important. And also make sure that, because a lot of them resist medication, they feel taking medication is going to make them feel worse. So make sure that they take their medicines, not just give it to them and say, no, you will take it. Make sure that in front of you they take the dose.
So you have to invest your time and
yes,
care.
a lot of time.
Yes. Thank you. Another question for you, and I think this is an interesting one, is about meditation and medication. Many people feel that a combination of both would be useful. Some people believe meditation is the only way to mental health improvement. What is your thought?
As far as mental health goes, and actually physical health as well, you can't take a position that only one treatment is going to work. Every individual is different, every case is different. Having said that, there's lots of research now saying that for mild depression, yoga and meditation heals the brain and mind, causing the same changes in the brain that we expect to see when the medicine is successful. So, now when someone has mild depression, obviously we emphasize lifestyle, yoga, meditation, nutrition, and so on. Having said that, there are many cases where you also need medications. And even in cases where you need medications, things like yoga, meditation, exercise add value and increase the power of the medicine and improve healing and recovery. So they're not mutually exclusive, and it's important that we understand they're not mutually exclusive.
Do you think that the person will take this younger person, even if the younger person was to ask an older person to help, do you think that the fact that it is the younger person who's identified it would convince the older person that he or she needs help?
I don't think this is really about convincing at this point.
Right.
I think it's about highlighting. And very often when a younger person highlights something to an older person, because of sheer lack of awareness, I think one of the things that happens is they do make a note. They may not agree immediately, but they will at some point reflect. So I think it's about highlighting and not convincing.
Deepika, very often over the last 2 years, you may have read about yourself and heard about a whole lot of people coming up with this opinion that, she talks about depression because, it brings publicity. Not from a media standpoint, but for yourself, how do you deal?
Well, I think like I said earlier, I think it's part of the acceptance. I think the joy and satisfaction that I get, call it a selfish thing if you have to, but I think the joy and satisfaction that I get when I see people change, when I see people seeking help, when I see people who've bottled up their emotions the same way I did for many, many years, when I see them coming out and getting the help they need or talking about it, and there's no bigger joy than that.
So this question came to you particularly from Pooja. Okay, and this question comes from Nick again to you. Do you always then have to pretend that you're very strong, even when at times you just want to be weak?
Oh no, not at all. Not at all. I think for people who know me know that I'm extremely expressive, that I'm very, very emotional, that I'm very, very sensitive, and so maybe during the time that I experienced depression and I didn't know what I was going through, yes, maybe at that time, because there were days, like I said, I didn't feel like doing anything. Those were the days I felt like I didn't want to do anything, and I literally had to drag myself out of it. But no, I feel like
So this question I would ask all four of you, because you're all successful in your own right, and this question comes from Tripti. That when you're working the whole hog, and then you give yourself time off for whatever reason, a sabbatical or whatever, because she's right now going through a point in her life where she's not doing anything at all, and she's extremely bored, and she's anxious that might lead to depression. So Dr. Shah, how would you like to answer that?
Boredom is a feeling that you don't know what to do with yourself, with your mind, you're feeling restless. Depression itself can sometimes cause boredom. The other way around is, boredom doesn't lead to depression. However, having a full life definitely is a good way to prevent depression. So if one is bored, then I would suggest find some hobbies, find something that really connects with your passion. Fill your life up with things, and not just about pursuing your career, but also connecting with people, spending time to talk to your friends, nurturing yourself. I think to have a balanced life is very, very critical.
Nana?
I think I look at boredom with three questions to myself, personally. And that is, are you bored because you don't get intellectual stimulation? Are you bored because you don't have a structured life? Or are you bored because you're not feeling recognized or, in a sense, identity? I think if you examine those three questions, then it kind of opens up which
avenues.
Yeah, for you.
boredom. I can never be bored. I can never ever be bored. I think, in fact, I'm completely the opposite. I don't think I can ever just sit in one place and not do anything. Not to say that I'm overworking myself, but I find ways, like Dr. Shan said, I find ways to keep my mind engaged. Even if it means cleaning a shelf, cleaning my cupboard, organizing my kitchen. For me that's an off day. That's an off day for me. I find that extremely therapeutic. So I'm always looking, or cleaning somehow makes me feel, like maybe I get that from my mother, I don't know. But just,
dishwashing,
cooking. It's So I don't ever find myself, or if I don't feel like doing something physical, even if it's engaging with like a TV show where I invest my mind into something, into another world, there's always so much to do.
I really don't know what she means. So, if someone has had a very hectic work life, and then it's always nice to have that little span where you're doing nothing and you're just. I won't call it boredom then, allowing your mind to relax. It's very important that your mind relaxes as well. It's not just physical relaxation.
Recharging batteries.
Yes. So for someone who has a very hectic lifestyle, and then you give yourself some time to relax your mind and go into that little space of boredom, I think is perfectly fine. But of course, if it's prolonging and then you're feeling useless about yourself, then pick up a hobby, or even just making a good set of friends and doing something together, as long as keep yourself engaged.
Thank you.
Thank you.
Thank you.